Here at Maxwell Dental, we treat a lot of kids. Cavities, they're everywhere, and kids are very, very prone to getting cavities. It comes down to the chemistry of their teeth. Baby teeth have a really, really thin layer of the hard enamel structure of the tooth on the outside of the tooth. It's not like an adult tooth. Adult enamel is very, very dense, very, very hard, very rich in minerals. And kids' teeth just don't have that. They don't have the minerals. Kids' teeth are very susceptible to decay. And their eating habits are very different from adults, which puts them at an even higher risk for developing decay or cavities in their teeth. They love to snack. They snack all day long. I mean, I have 4 kids. I know it's like they're cattle. They're grazing all day long. It makes it challenging because, you know, their teeth are dirty and constantly getting food stuck in them and plaque, and you wonder at the end of the day, you know, you brush their teeth and you're like, oh my goodness, like how did this even happen? It looks like a disaster in their mouths. Doesn't always mean that they have to have a filling right off the bat, which traditionally we think cavity needs a filling, but it's just not the case. We've got 3 different approaches that we use to help kids and solve this problem with decay. First option that we always talk about is curing decay with ozone therapy. Now, many people have probably never even heard of ozone therapy before. It's very, very cool. So ozone, people have heard that word before, but maybe they're not quite sure what it is. Ozone is everywhere, and it's very reactive oxygen. When we use that reactive oxygen in dentistry, it helps to kill the bacteria that cause decay. So let's say your kid has a little bit of decay, it's very, very minor. We can actually use ozone to help kill those bacteria that are causing that decay, give the tooth a chance to heal itself before you just jump straight to doing a filling. Let me tell you, kids do not like getting fillings. I remember getting fillings as a kid and it wasn't pleasant. So we offer this alternative, much more natural approach to healing tooth decay without using needles or freezing or drills or anything like that. There are some downfalls though. It's not effective all the time. If decay has progressed to a certain point, ozone is not as effective as we would like it to be. So we have other options. One other option that we use is a product called silver diamine fluoride. Now, you hear the word fluoride and think, oh, you know, who is this guy? Is he a quack? Well, just hear me out for a second. Silver diamine fluoride is a very spot-specific treatment for decay. So maybe you're used to going to the dentist and having those goopy trays full of fluoride in your mouth, or fluoride rinses and that sort of thing. Maybe fluoride in your toothpaste, and you're swallowing a bunch of it, your kids are swallowing a bunch of it, and you're just concerned about the health effects of that. So I get it. I get that there's concerns with fluoride. The silver diamine fluoride is amazing because the silver kills those same bacteria that the ozone was targeting, but then the little tiny bit of fluoride that's in there helps to rebuild the tooth. So it's great. You stick it exactly where it needs to go. It kills those bacteria and it gives the tooth a chance to heal. Again, without the use of freezing, without the use of needles or drills or anything like that. So those are 2 non-invasive ways that we can treat your kids' decay, their cavities. Now, beyond that though, if it looks like we're unable to reverse that decay and heal those teeth, we do fillings. We do lots of fillings on kids, but we don't use mercury fillings. We don't use metal fillings on kids. We don't use metal caps over kids' teeth if you're concerned about having metal in there. We just use white filling material like an adult would get. It's pretty different here at Maxwell Dental. It's different because we give you multiple options. You can choose whichever way you want to take to help your children with their tooth decay and ultimately treat them the way that you would want to be treated.